Hi, thank you for joining us today for SNF Agora Conversations, the Politics and Policy of COVID-19. I'm Yasha Bunk, a senior fellow with the SNF Agora Institute. SNF Agora is a pretty new institute at Johns Hopkins that examines challenges to democracy and identifies actionable solutions. We created this new weekly series to offer a social scientific, evidence-based approach to exploring the difficult political and policy issues that are facing us around the world right now. I'm excited to be part of it, leading today's conversation on protecting both public health and civil liberties during this pandemic. And I'm even more excited for our two guests. Danielle Allen is the James Bryant Conant University Professor at Harvard University. She directs the Edmond J. Safra Center for Ethics, which has put up a fabulous report for how we can reopen the economy without making ethically dubious choices. We also have Robert C. Lieberman. He is the Krieger Eisenhower Professor of Political Science here at Johns Hopkins University. Thank you to both of you for being with us today. So I wanted to talk for an hour about the deep moral trade-offs that face us across different dimensions of this pandemic. And then we'll open our questions up to you. Anytime throughout this conversation, you can submit your question through the dialog box, which is right next to the video or just below it, depending on your device. Please note that our panelists are not medical experts and we cannot answer any medical questions. So look, I think the biggest question that's facing us at the moment is that people seem to think there's this trade-off between economic activity and human lives, that we have to choose between having a livelihood, between making sure that people have jobs on the one hand, and ensuring the safety of people around the country and around the world on the other hand. Is that the stark trade-off we face? Do we just have to choose between our lives and our economy, or is there some other way in which we can move forward that's more productive, that involves less stark moral choices than that? Danielle, your center has written a lot about this. Please give us a little bit of good news.
Sure. No, thank you. No, we do not think that there is a stark trade-off between the economy and lives. We think that there's a mistake to think of this in a sort of conventional cost-benefit analysis way. Cost-benefit analyses are relevant to what we're all wrestling with, but we have to recognize that we also need to focus on existential threats and how we respond to existential threats. So you can do cost-benefit analysis when you're in a stable world where you have a stable political and institutional structure able to deliver decision-making. The problem we faced when the pandemic hit was that the shock to our health system was so severe as to produce an existential challenge to all of our institutions. If public health systems fail, then that generally erodes the legitimacy and all of your institutions begin to destabilize. We needed to respond quickly and aggressively to prevent that, hence the collective quarantine. That produced a second existential threat or shock, namely the profound economic dislocation. And so the point that we have to all get our heads around is to recognize that it's much more like a sort of situation where, sort of in effect in a war context, not an actual war, but that you have to think of yourself as being on a war footing, where you have existential threats that you have to fend off and you need to mobilize all of your resources, including the economy, to fend those off. You can't fight any kind of war without a functioning economy. So in that regard, saving the economy is actually a part of saving lives. These things go together, and the job is to figure out how to integrate and find an integrated policy pathway that permits success in relationship to both existential threats.
I agree with I agree with what Danielle's saying. I just remind everyone that this is a serious existential threat, as Danielle says. I mean, the pandemic has already killed more Americans in a couple of months than the Vietnam War did in 10 years. And I think we're past the point where we can be thinking about these kinds of trade-offs. We need to mobilize the economy, and it would be better if we had better national leadership around economic recovery. But I think Danielle is absolutely right. This is not a trade-off.
So we should probably say more about what that means a little bit. Is that okay, Yasha?
Yeah, I was going to say, I have two questions actually, which is, what do we need to do in order to avoid that stark trade-off? And then are we actually doing that? I mean, I wrote, early in this pandemic, a piece called Cancel Everything, because I thought that if we really go into some of the measures we're now taking, which is to, very severely slow the spread of disease right now, it'll buy us the time to take the kinds of measures which allow us not to have to make those tragic trade-offs.
Right.
But I'm becoming increasingly pessimistic and skeptical that the US is actually capable of taking those measures while we're at home, slowing the spread of it.
Well, so let's separate out that into two questions. I mean, so one is, what is that pathway that integrates protection of health and health systems and protection of the economy and mobilization of the economy on behalf of the security and well-being and health of all of us? So that's sort of question one. And question two is, if we can see that pathway that integrates those things, how feasible is it? You know, can we really get on that pathway, or will we fail to, such that then we do end up with harder results? So basically, with regard to the pathway, it's really important that when I say, you need to mobilize the economy to fight the disease, it doesn't mean just sort of opening the economy and letting the disease run wild. To the contrary, the single greatest economic shock that we could experience would be if we did do that and took that hit to loss of life. So even in the sort of most kind of rudimentary cost-benefit analyses, if we sort of took a surrender path, let the disease run rampant, accepted the sort of loss of 2 million lives, that would be a hit to the economy, $15 to $20 trillion in the sort of analysis that economists use for measuring the value of a life and its impact to the economy. That's actually even more expensive than the cancel everything kind of freeze in place approach that we start out with. And it's yet more expensive than a mobilized pathway, where what we need to do to have the economy open and open safely so that we can stay open and not repeat social distancing is that we need a tool of disease control just as powerful as collective quarantine, but without the economic costs of collective quarantine. And so the tool that's available that does provide disease control is testing of people, contact tracing, supported isolation so infectious people can go out of circulation. So that's the integrated pathway, is that you mobilize your economy to build a tool of disease control that is also economy protective, right? It's health protective and economy protective simultaneously. So that's the goal. So then we get to the feasibility question. And yes, like that one breaks into two parts. There are no laws of physics that have to be broken to achieve this. It's purely a question of breaking laws of politics to achieve it. And our political dysfunction is a real question. And it is entirely possible that our political dysfunction could end up, having us just as a de facto matter fall into a kind of back and forth between a surrender policy of letting the disease run wild with peaks rising up. You'll get sort of political blowback from that, political pressure, and then it will shut down again. And then the economy will be constantly affected in a negative way by that. So we could end up in that world where we're bouncing back and forth between surrender and freeze. I sure hope we don't.
Yeah. Look.
So there's three elements of this, right? There's the testing element, which is very, very important, and we're seeing that the United States may not be able to get enough tests done quickly enough, but it doesn't, in my mind, raise any particularly complicated ethical issues. But the other two steps of this have some real ethical trade-offs, right? So the first is around the contact tracing. And we see that some countries like South Korea are very strongly asking their citizens, and perhaps at some point will be requiring the citizens, to download apps which trace exactly where things, so that if you've been in contact with somebody who's had COVID-19, you will be informed of that very quickly. So there's ethical issues about how much power we should give the state in order to trace our movements in that kind of way. And then the third element of this is quarantine. And there's real questions about whether we can rely on people to actually self-isolate sufficiently without some form of government control, or whether we need government agents to check in on people's self-isolation mechanisms, or perhaps even, as China has done, to put people up in temporary hotels so that we know that we're not going about infecting other people. Rob, do we have the ethical answers here? Do you think that if that's what's required in order to save lives and reopen our economy, we should give the government the powers to have so much control over our movements and so much information about what we're doing?
Well, look, we accede to government control in this kind of way in a lot of areas. I mean, some as trivial as, I live on a one-way street, so when I pull out of my driveway, I can turn left and not right. But also in terms of public health, we mobilize enormous investments on behalf of public health. We require vaccinations, which are somewhat controversial. But there are all kinds of things that we do as a society to protect and promote public health. In times of crisis, historically, we've embraced even greater government control of all kinds of things. And that doesn't necessarily have an ominous or ethically dubious cast. I mean, look at Franklin Roosevelt's response to the Depression. On his first day as president, what did he do? He closed down all the banks in the country in order to reset the financial system. People at the time in the early 1930s were skeptical that liberal democracy as it was practiced in the United States had the spine and vigor to meet the emergency of the Depression. People, including liberal columnists like Walter Lippmann, were urging Roosevelt to assume much greater almost dictatorial power over the economy and society in order to meet the emergency. So there's a history of this kind of assumption of government power, and we often accede to it. The controls that are now in place in terms of stay-at-home orders and quarantine regulations and so forth have extremely high levels of support among the American public right now. Where this becomes problematic is where it spills over into much more dubious assumptions of government power. So even in the context of the Depression and World War II, as soon as the war started, the government assumed much greater power, imposing censorship on the media, ultimately imprisoning 100,000 or more Japanese Americans. We saw this in the War on Terror, which led to warrantless wiretapping and secret surveillance programs. So there's a line between the necessary controls that we need to meet the emergency and the sort of overreach of the government. And that's what we have to guard against. And that's where some kind of structure of the rule of law and transparency about what is being done and why is really important.
So I think everything Robert said was really valuable and helpful. I think the pandemic has given this country in particular a huge shock. There's a really powerful sense of novelty. And I think in the space sort of psychologically opened up by that shock, there's room for a lot of imaginings of things that at this point I think are at some distance from reality. So I think it is important to bring people kind of back to the reality of what contact tracing as a public health tool actually is. It's not a new tool. We've been doing it for hundreds of years. It is the tool that's helped societies consistently get out of crises ranging from tuberculosis to syphilis, HIV/AIDS, a whole variety of things. And so in this country, I mean, our most recent major experience with contact tracing wasn't the HIV/AIDS crisis, sort of at scale. I mean, we've had it as well for measles outbreaks more recently and things like that. And we learned a lot of lessons from that crisis. In the beginning, it was not very effective. It didn't work well. And for exactly the kind of reasons that Yash is pointing to. Members of the affected community were extremely worried and uncomfortable and felt exposed by the engagement of the government, for example, in identifying people who were testing positive and sort of trying to trace their social contacts and things like that. So what we learned in that crisis is that contact tracing is effective when it is run by organizations who are trusted by the communities within which those organizations operate. So there's a bill actually in the Senate at the moment, which is about standing up a person of about 1 million people to be contact tracers. That includes as its requirement that contact tracers live within 50 miles within a 50-mile radius of the place where they would actually be working. And relatedly, there's a great program in New York to this day for HIV/AIDS contact testing and tracing, which recruits community organizations as partners to run contact tracing programs. So it's not even the state that's doing it. It's a civil society network of partners who are trained up by public health authorities and officials. And so that's really the level at which to think of this operating. County public health officials, local municipal leadership, community organizations with structures built in diverse ways in different places to really connect with the communities where the work is being done. And the important motivator for the work of contact tracing is that we all, I think, want to be alerted if we've been exposed to infection. And relatedly, I think, honestly, we all have a moral duty to warn other people if we have unwittingly exposed them. And so it really is, contact tracing comes out of that sense of looking out for ourselves and each other, community, peer-to-peer sharing of warnings. That's how it has historically worked as a public health tool and practice in its best forms. And that's what we should be looking to set up in this context, because it is one of the most powerful tools that we have available for disease control.
So I agree with everything that both of you have been saying, but I'm getting a little bit nervous that perhaps we're now too careful not to acknowledge trade-offs, or to say that all good things go together. So when I've been speaking about these questions for the last weeks, I've always said there should be at least 3 conditions in place for any measures that governments now take against the coronavirus pandemic. The first is that they need to be democratically legitimated and, where appropriate, under some form of judicial oversight. The second is that they have to be temporary. So there has to be a sunset clause as to when those kind of measures lapse, and they have to be proactively prolonged if that's necessary. And the third is that they have to be strictly necessary to save lives. And of course, the actions of many governments around the world don't accord with those conditions. When you look at Hungary, for example, the government there has essentially completely sidelined the parliament, allowed Viktor Orban plenipotentiary powers, and there is no temporary element to this, though hopefully it will at some point end. There's no sunset clause. So, I think that's helpful, but there are still important trade-offs in areas that fulfill those 3 conditions. I mean, what about those questions around quarantine? If we find that 25% of people who are informed that they have been exposed to COVID-19 don't self-isolate efficiently, should the government have a power to punish them? Should the government have a power, if needed, to forcibly put them into a hotel or into another form of accommodation where they can be supervised for a few weeks? That seems to me like a pretty clear trade-off between public health and, on the one hand, and civil and individual liberties on the other hand.
So let me jump in there. So I agree with your first 2 criteria, but I would articulate the third one slightly differently. So I agree with you that all of these measures need to rest on a foundation of democratic legitimacy. And we spent a lot of time in my center working on the question of how to activate our Federalist structure in effective ways for exactly that purpose. And I also agree absolutely with your second point about time limits. And that's a feature, excuse me, of already existing public health emergency law, as that the best versions of those laws are very clear about timelines. And yes, set deadlines. And then if it does need extension, you have to proactively extend that based on justification. So 100% agree there. With regard to the third about being strictly aimed at saving lives, I actually would put it in a slightly different way. I think that the goal here is to restore the risk profile that the society faces to the levels that are consistent with the other features of our social life that involve risk, ranging from driving to influenza and things like that. So in other words, we're not going to save every single life here, okay? I will go ahead and say that. But what we want is a context in which people can make reasonable decisions about their own safety in the face of a reasonable risk situation. So high prevalence rates of COVID are not a reasonable level of risk for people to be exposed to. Low prevalence rates of COVID, I think, will be a reasonable level of risk. People will still have to make their own decisions about the kinds of things they do and participate in. I believe that makes sense in the context of a well-developed testing regime that makes it possible for you to really know what the differential risk profile is across the society. But that's how I would put it. It's really about restoring us to a place where the risk profile is reasonable. And that point about risk profile has built into it a picture about trade-offs, right? So in other words, with driving, to use the sort of example that Robert brought up earlier, we don't build a system of driving that ensures that there's not a single life lost. We don't. What we do is build a system where we think the risk profile is reasonable, that people can understand their risks, make their own choices, and have scaffolded safety and protection to maximize the likelihood that they will succeed in relationship to their own choices and judgments about risk. I think that is what should be our goal here as well, roughly speaking, equivalent. So I think that's a really sort of important thing to say. So then when it comes to sort of question of your trade-offs, again, we don't have to dream up whole new things. I mean, we have existing quarantine laws and procedures. A whole lot of the structures in this country work on voluntary incentive basis, build in supports for isolation so that it's worth it for people to do. So that's an important thing. You can use positive incentives. They don't have to be negative incentives. But other societies have penalties, including democratic societies. So Canada has a sort of structure of penalties around quarantine already. So I think, we have tools that we've already kind of vetted from a civil liberties perspective where we've made these judgments about trade-offs. The real question we face, and the hard one that I think you raise, is if we find ourselves finding that we feel that we need to make recourse to those harder, tougher tools at scale, does the question change? And I think that is a real and important question, and that one that we should sort of work on and think about. So I'll give you that, but I think it's of that kind, the nature of the question.
I agree with everything that Danielle just said. I think the thinking about this as a problem of risk is exactly right. Life isn't risk-free, and we need to create an acceptable risk environment for people to go about their everyday lives. The one of your criteria, Yasha, that I would emphasize is the temporary nature. There is a history, and this is something we worry about, of leaders, even democratically elected leaders, using these moments of crisis and moments of emergency to ratchet up their authority, their power, and their control over the society. And then when the emergency passes, not necessarily letting those controls lapse. And I think we see that in other countries in the world, as you point out, in Hungary and elsewhere. Leaders like Viktor Orban are seizing on this moment to accumulate power. And I think that's what we have to guard against. So I think the temporary nature of any of these kinds of controls that we impose now, even if they seem draconian or overly controlling, I think we need to make sure that they're temporary, and that once we are able to reset our lives in the way that Danielle described, that we can come back to them and rethink them and remove them when we think that that's an acceptable thing to do.
So that's actually a perfect cue for the next thing I'm trying to think through, which is that obviously we're hoping that all of those measures that both of you have outlined will only be temporary, that we will eventually be able to cease them because we either have a very effective treatment against COVID-19 or a vaccine. Now, there's a real set of ethical questions that's being raised in yesterday's Washington Post, for example, by the philosopher Peter Singer, about how we should be trying to develop those treatments and those vaccines. In ordinary times, the primary imperative of medicine is do no harm. So we go to extraordinary lengths to make sure that vaccines or treatments that might be very beneficial are tested in ways that don't impose harm on any of the people who are being tested by them. Now, Peter Singer is arguing that under these extraordinary circumstances, we should be thinking about those rules a little bit differently. That actually, if there are volunteers who say, I'm happy to be injected with this vaccine, or I'm happy to be exposed to COVID-19 after getting a trial vaccine in order to see more quickly whether it is working, or I'm happy to get this particular drug and see whether it works, even if it might have severe side effects. We should allow that because of the number of lives that are at stake, because of how much it could accelerate our ability to actually master this pandemic. Do you agree with Peter Singer? Do you think that the rules that normally govern those kind of research endeavors are inappropriate, either in general or in the current situation? Or do you think we should not deviate from them?
So, Robert, were you going to go ahead?
No, go ahead.
No, I think those are really hard questions, and this sort of issue of human challenge trials for vaccine development, I think that's the next really big kind of ethical conundrum to focus on. I do think that the existing rules continue to be important. So it is exactly the kind of context where you make a distinction between the kind of action which is directed at a specific person and that could bring them quite significant potential harm. And I don't think that we can use sort of number of lives cost benefit analysis to justify that choice in relationship to the person in front of us. So from my point of view, there is a fundamental problem with the human challenge approach to vaccine development. I think that there are other features of acceleration to the development process that we should look at. But the specific one of human challenge studies, I don't think is the right course. I've only started to think about this, I'll say that. So, and I want to acknowledge it's a very hard problem.
Rob.
Yeah, no, I agree. I think, look, I'm not a medical ethicist, but I think, the medical research community has developed a very careful and thoughtful set of protocols and ways of thinking about the relationship between risk and discovery. So I'm skeptical of this kind of free-for-all approach to to that kind of development.
So let me be the devil's advocate, or in this case, the advocate of Peter Singer, just to spice up the conversation. I mean, weren't these rules developed under very different circumstances, where the point was that actually we have an incredible set of tools for treating most diseases. And the difference between coming to a treatment a year earlier or later can be real for the lives of some people, but it is relatively limited. And on the other hand, the potential damage to the reputation of medicine from a vaccine that turns out not to work, or from a drug that turns out to have deep side effects, is very, very large. And so what was really motivating our ethical impulses here was not just the idea that it's somehow completely impermissible to the person sitting in front of us, that if they are volunteering for this, they may suffer harm. It's that on a kind of more rule utilitarian basis, this actually is penny wise and pound foolish. That whatever lives you save through this kind of approach in certain cases will undermine trust in medicine to such an extent that it costs lives in many other circumstances. But now we're faced with a situation where, say, we have a vaccine candidate that really might transform life for everybody on Earth in a relatively quick period of time. It might save scores of lives and allow us to go back to having friends over for dinner, to hugging our grandparents and so on. And we have people who are saying, inject me with this vaccine. It would give great meaning to my life to be one of the brave people who are taking this risk. But because of the rules we've developed under these very different circumstances, we're going to be telling those people, no, that's unacceptable. We're not going to be doing that. I feel like there's more on the other. I don't know where I stand, but I feel like there's more on the other side of the moral ledger here than we've perhaps brought out in the last exchange. Am I wrong about that?
Well, I mean, you know, look, this is not the first time in living memory that we've faced this kind of challenge. And I mean, in the 1980s, during the HIV/AIDS epidemic, the first peak of that epidemic, when, you know, our friend Anthony Fauci was at that time, at the beginning of his tenure as the director of infectious diseases at the NIH, he came under enormous criticism at that time for what seemed to be the very slow process of developing not a vaccine, but retroviral drugs and other kind of treatments that would slow the progress of that disease. You know, I don't have a solution to a real answer to your question or a solution to the ethical conundrum. But even this is not a new problem. The pace of science and the pace of discovery in these cases is a challenge. And again, there are trade-offs here between the imperative of getting a vaccine or a treatment that can come online and be effective quickly. But we have to do that in a way that is safe, that doesn't violate the rights of consent and the understanding of the risks to, you know, test subjects and so on and so forth. So that's a sort of long non-answer to your question, but it's not an unprecedented problem.
So, I mean, I guess the thing I would add, I think the thing sort of worth thinking through, I think, you know, Yasha, you've done a nice job of bringing out the complexities of the conversation. We might also draw on analogies from the context of war and just war theory and so forth, and think about how do we approach recruitment of soldiers? How do we think about recruiting soldiers into battles where their lives are absolutely at stake and they know that going in? And so the question would be really whether or not this context is adequately analogous to such a context, or is inside the practice of medicine. I think that would be a thing one would want to think about. I think the other issue is that when we send soldiers to war, the state sends soldiers to war. Individual clinicians do not send individual people to their deaths, right? And so there is a question of authority and legitimacy in making such a request from people that I think would have to be in the mix as one is thinking about this.
Great, thank you very much. Well, I think this has been a wonderful conversation so far, but I do want to make sure that we get the audience into the conversation as well. So let's take a few questions from the audience. Again, if you have a question for our panel, you can ask it through the dialog box on the screen either to the right or below the video, depending on your device. And I'm being asked to repeat the warning that we are not medical experts. And if you have medical questions, there are other people who are definitely better qualified to address those. So I have one question here from Andy Perrin, which has been on my mind as well. He says that he's very convinced by the approach that Danielle has been advocating, but there's a kind of problem with it, which is that we have huge dysfunction at the federal level. And so a lot of those measures do seem to be addressed to the federal level, or at least assume that we're going to have some kind of coherent federal response. To what extent do you think that states can substitute for a federal government that doesn't take those actions? Is it possible to build 50 versions of this regime across the country? What should states be doing in the absence of a coherent federal response?
So we published 2 white papers yesterday. One is called Federalism is an Asset, and the other is called Interstate Compacts, a Primer. And I would encourage you to go check them both out. You can find them at ethics.harvard.edu. And in brief, this pandemic does require a whole of government response in the sense of all layers of the federal system. There is a necessary role for the federal government, but there are also really critical roles for local and county level officials, as well as for state governmental officials. And there's a heck of a lot states can do on their own. So actually the pathway we map out, the testing, tracing, support, isolation pathway, can be achieved by states, particularly via the vehicle of an interstate compact. The most famous one is the New Jersey, New York Port Authority Compact, where this is a compact that's formally blessed by Congress that permits delegation of certain powers to the states to do projects that rise up to a level of sort of complexity that you would typically associate with the federal government. So it is within the realm of the possible that the states that are forming these coalitions could actually formalize that as a compact that would give them the power to activate the supply chain at the level that we all need collectively to pursue this. So we do also need support from the White House in the sense that anything Congress does requires the Senate and its blessing, and the Senate takes its lead at this moment in time from the White House. So there's no pathway that does not involve the affirmation of the White House for it, but the bulk of the work could in fact be carried out by the states.
I agree up to a point. I mean, there's a lot that states can do, and certainly in the realm of direct mitigation of the effects of the pandemic, contact tracing and those sorts of things, the states are going to have to be on the front lines. But a state-by-state response in many other respects it's doable, but suboptimal. And we've already seen that in terms of mobilizing resources, producing or the ability to test or ventilators or personal protective equipment are the things that really only the federal government has the capacity and the resources to produce at scale. There, the vacancy of the federal government has been a real problem. And secondly, in terms of the economy and the economic response, states are very limited in their ability to respond fiscally. They just don't have the money to respond back to your very first question, Yasha, to respond to the economic impact of the pandemic. And without a more vigorous, concerted federal response and more federal money behind things like paycheck protection or unemployment insurance, the economic impact is going to be more severe than it has to be.
Yeah, it seems like federalism can be a great asset when there's a lack of leadership at the federal level. States can step into the breach to some extent, but there will always be a variety of how effective those approaches are. And one of the things that keeps me up at night is what happens if some state manages, say Maryland manages to manage this pandemic very, very well, but neighboring states don't. And I have a question from the audience about that. Would that undermine the effect of the state response, or would we get to a world in which governors have to actually impose hard borders along the lines of states within the United States, as we've seen national borders being reimposed within the Schengen zone in Europe?
So the Constitution, as it's been interpreted over the last 200 years, does not permit barriers for interstate travel. So just as a sort of opening frame, the odds of our using that kind of tool are very low. As we build out a state-by-state testing, tracing, and supported isolation program, it will be important that the federal government, through the Department of Health and Human Services, also establish a minimal threshold floor for that kind of work in those places where the states are themselves not achieving that minimal threshold or floor. And that is work that the Department of Health and Human Services already does. They have structures for doing it, for direct service provision, precisely in those contexts of shoring up, providing a minimal floor. So the real question is, how much of this can Congress do? What's the role of the White House? Both parts do have a role to play. The White House has been moving. I think it's important to pay attention to that and to do what we can to put wind behind the sails for the direction they're currently moving in. The way that they've been moving is most visible in the fact that they changed their CDC guidance on testing this past Monday. So up until Monday, the guidance was that you could only test people with symptoms and that it was literally not a priority to test people without symptoms. The only way we can actually test in the ways that we need to control the disease is if we can test asymptomatic people. 40% of infectious carriers of the disease are asymptomatic. So they've now changed their guidance to include testing of asymptomatic people as a priority. That is a hugely important development. It is also a signal to the supply chain of test makers that the market for tests is much bigger than they had thought it was. So the White House is moving. I hope people can see that, and we need to put wind behind its sails so that they consider it worthwhile to keep moving in this direction aggressively.
Let's move to a related topic that I have a whole set of questions on, which is about trust. You know, a lot of the measures we've been talking about require a lot of buy-in from the population, a lot of trust from people around the United States. And we're already seeing that there is a significant portion of US population that's not going to trust the federal government, not going to trust the state governments sufficiently. So to what extent is there a danger that this lack of trust in the government is going to undermine our ability to build the kind of test and trade regime that we've been talking about? Perhaps, Rob, if you want to come in on
that. Well, I think, I mean, that is an overall, it's a general issue. Trust in the government has declined notably in the last few decades, so that's an issue. I wouldn't want to overstate that right at the moment, where in terms of where we are right now in this pandemic. Something like between 85 and 90% of Americans in a recent survey said that they support the current level of restrictions. They think the current stay-at-home restrictions and other regulations that have been imposed are either about right or don't go far enough. So right now, what the government is doing has overwhelming support. But I think we need to be, it's something we need to pay attention to, and especially when you have a federal administration that seems to be kind of science averse and doesn't seem to carefully follow evidence-based policy, not just in this area, but across the board. I think that makes me worried. That tends to undermine, is going to potentially tend to undermine trust and faith in the government response going forward.
So I agree with Rob about the importance of the declines in trust in federal government over the last few decades, but I would put on the table as counterweight to that the continually high levels of trust people have in their local governments. I mean, that's really the interesting feature of the trust data, is that people do continue to trust their local governments at quite high levels. And so I think that again speaks to the importance of seeing what an important leadership role local municipal leaders and county public health officials have for all of us in responding to this crisis. So for me, the real question is, the place where we should worry is whether our local leaders and public health officials have the capacity they need to do the job that is landing on their shoulders. And that's where the sort of decline of investment in public health infrastructure over the last decade or so is damaging and dangerous. Like, that's what keeps me up at night. I think the trust problem is not a problem if we focus on the local level, but then our local folks have to have the capacity to pull this off. We've underinvested in them. We need rapid reinvestment in order to equip them to meet the responsibilities now on their shoulders.
So I'm going to abuse my chair's privilege to ask what may end up being the last question. What's the outlook? It sounds to me like you're both actually quite optimistic about us being able to build this test and trace regime. If that is the case, what might the next 6 to 12 months look like? And will we be able to avoid the worst kind of moral dilemmas that we feared in the first weeks of this pandemic, when we thought, for example, that we'd have to think very hard about triage medicine because we may run out of the number of ventilators that are available to severely sick patients?
So I'd love to respond to that, but Rob, if you want to go first.
Yeah, well, I guess I am reasonably optimistic, and I think the points, especially the points that Danielle has made about the capacity of the states to establish these testing and contact tracing regimes that will get us on the road to some kind of normalcy. Whether the new normal is like the old normal remains to be seen. I think there's a reasonable chance that that will happen in relatively short order, 6 to 12 months. I don't know. I'm not a public health expert, but we seem to be groping our way toward that kind of solution. What worries me more, what keeps me awake nights, is the problem of economic recovery. There, I think the states are going to have to take a back seat because they just don't have the capacity or the money to do what needs to be done on a big enough scale. And it's going to be a long, long time before we as a country are going to be able to dig ourselves out of the economic hole that we're now in. That's going to require federal leadership. And there, given the sort of triangular relationship between House, Senate, and White House, at least for the rest of this year, that to me is going to be a longer slog and take a lot more work.
So, for me, the tragedy here is that everything that I've been trying to articulate today, and at this point, lots of people are articulating, the policy landscape has really converged around the strategy of disease control that I've been articulating. This is work we should have done 2 months ago. And so for me, that's the tragedy. And so in terms of like the sort of time frame for getting it done, it's like it's yesterday. And we need to be moving that fast with that sense of urgency to make this happen. But the thing that does actually give me hope and optimism, I'll just share the best thing that happened to me today, which is the best thing that's happened in a spell, which is a couple of days ago, 4 scientists published a piece in the MI Technology Review laying out the work they've been doing for the past month to be able to test at the level of millions a day. All right, and that's the feasibility question. Everybody's gonna say, oh, but you can't do that. You can't test at 5 million tests a day. It's not true. I've been talking to scientists this whole time, which is why I know it's feasible. At any rate, they published this article laying out the work they've been doing using human genome sequencing approaches and methodologies. It's a viable, valid pathway. It is one of several viable, valid pathways. And they wrote me this. I saw the article, I read it, reached out to them and said, hey, come on, we've got to pull you in. Let's work on building out the innovation pathway that comes from this work. And they wrote back to say they'd be delighted to participate because it was one of the first white papers that we published that said we all have to mobilize all of our resources to solve this problem. That inspired them to do this work, okay? So the point is that if we set our minds to it, if we can all agree that what we really need to do is mobilize and make it possible for this society to test at the level of millions of people a day, 5 million people a day, we have all the ingenuity, all the resources, and we can even do it fast. But it just requires that total collective focus and shared commitment to achieve it. So I'm optimistic because I know that kind of focus can make really powerful things happen. That's the evidence I got this morning from these scientists who have developed a millions a day testing methodology.
Well, listen, I'm entirely unsurprised that this short conversation was full of brilliant insights from the two of you. I'm a little bit more surprised to be coming away from it feeling more energized and more optimistic about our ability to beat this pandemic than I was 45 minutes ago. So I owe you double gratitude. Thank you so much for joining us, and thank you to our audience for watching and sending in great questions. Please join us again next Friday for a conversation on the effects the pandemic is having on climate and food security, another very important issue. Our guest next Friday will be Martin Blöm, Director of the Center for a Livable Future at Johns Hopkins Bloomberg School of Public Health, Jess Fanzo, the Bloomberg Distinguished Professor of Global Food and Agricultural Policy and Ethics at Johns Hopkins University, and Jonas Nahm, Assistant Professor of Energy, Resources and Environment at SAIS. I also want to mention that a recording of today's webcast will be available at snfagora.jhu.edu. I hope to see you again next week.
Thank you, Yasha. Good to see you.
Thank you, Yasha. Thanks.